Hey, this is Dr. Scott from Health Optimization Medicine and Practice. I'm one of the faculty. And today I'm just going to describe a little bit about how I think about hyperbaric oxygen therapy, supplementation, and metabolomics. So in essence, what's so important to understand is that if you're going to optimize hyperbaric therapy, you're flooding the whole system with oxygen when you're doing that. You have to understand that you're going to cause machinery to rev up both on the input side, which is the making of energy side, and also the detoxification side. So what you want to do is think about supplementation before, during, or after to help support that whole process, and technology as well to help support that whole process. So one of the supplementation regimens that I typically would recommend is one that's focused on what people need, i.e. what they need on that machinery, the vitamins, minerals, nutrients, and cofactors that they need to help support energy production, and also the antioxidants that they need to actually support detoxification. So this is using a metabolomics test. Typically it's called an organic acids test. And the way you think about this is that it's a network-wide range of things that you're looking at. Your B vitamins, your antioxidants, all your intermediates inside the citric acid cycle. You can optimize all of these and you can actually support all of them with the right supplements that's going to help somebody support it, not only if they ever go into hyperbaric chamber. And that's kind of my secret overall too, is that I tell people all the time that many people don't actually need hyperbaric therapy, at least right now. Maybe they need it in the future, but oftentimes it's optimizing their cellular health first, their metabolomics. And then if we can do that, then everything else gets easier. And oftentimes hyperbaric therapy might not actually be needed right away, or maybe not at all until some sort of future event when they actually might require it or might benefit from it. So it's kind of my secret when I talk to people is that they usually find me because of hyperbaric therapy, but 90% of what I speak about that with them has nothing to do with hyperbaric therapy at all, and has everything to do with optimizing their metabolomics. So supplementation is usually directed at what they actually need from a vitamins, minerals, nutrients, and cofactors perspective, antioxidant perspective, so you support all of energy production. In addition to that, though, you can think of other supplementation that may also be helpful. Things like nitric oxide, for example. Nitric oxide is going to dilate blood vessels, and that can help get more oxygen to the places that you need. I also think about B vitamins specifically, right? If somebody's not taking B vitamins and they need them, fantastic. But if we don't have laboratory testing to go by, oftentimes I'll use B vitamins as a way to support all the aspects that B vitamins really are really important when you're supporting mitochondrial function overall. And then I also think about technology, of course, right? Technologies are things that can help support mitochondrial function. One of the biggest things that I think about is near-infrared light. Near-infrared light helps optimize nitric oxide production, energy production in the mitochondria. So I use that a lot before hyperbaric therapy. And then of course, after hyperbaric therapy, I'm also thinking about the things that can help with the detoxification process, right? Because we've increased all that oxygen in circulation, we've caused reactive oxygen species. So how can we help with detoxification? Well, some of the things I think about are some antioxidants, of course, things like glutathione or alpha-lipoic acid, depending on what people need. Now, you have to be careful here. You don't want to give these antioxidants directly after hyperbaric therapy. You want to give the hormetic stress of hyperbaric therapy the time, if you can. If people are super sick, though, and inflamed, you may not be able to do this, but in general, you want to wait a little while, just like you don't want to take antioxidants after a workout, for example. From a technology perspective, I love the infrared sauna. It's one that I have at my house. I use it all the time. It's a great way to detoxify, to sweat. You get rid of some toxins that way. You get rid of garbage that way as well. Lymphatic drainage, like doing a vibration, for example, or a vibratory type of stimuli can be very, very helpful in this capacity as well. And these are just some of the ideas that I think about. But in essence, what I'm doing here is focusing on metabolomic testing, focused on directing my supplementation to what people need, and then adding on before, during, and after whatever they require to help support the hyperbaric process. One additional thing is obviously hydration, and mineral hydration is really, really important throughout the whole hyperbaric experience.